Welcome! Lovelace Women's Hospital has partnered with March of Dimes to bring these video presentations to our NICU families. If you have any questions about the following material, be sure to talk with the NICU staff. This video presentation is for information purposes only. Always seek medical advice from a licensed professional. Today, we will learn about how and when to clean your hands, how to keep germs away from your baby in the NICU, and how to keep germs away from your baby when you transition home. Hand washing is the single most important thing you can do to prevent infection. Follow these 5 steps from the CDC every time you wash your hands. Wet your hands with clean, running water, warm or cold, then turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Lather the back of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands under clean, running water. Dry your hands using a clean towel, an unused paper towel, or air dry them. Lovelace Women's Hospital Policies. Steps for washing your hands when you enter the NICU are to follow the CDC's 5 steps, wash your hands for 2 minutes, wash your hands up to your elbows, and don't forget to get under the fingernails. Parents and guardians are given a copy of the NICU Visitor Guidelines when their baby is admitted into the NICU, which will go over who is permitted to enter the NICU, what infection prevention guidelines are in place, and more. Germs and bacteria. This is an image of a petri dish, which is a container used in research and medicine to grow different types of bacteria and germs. Anything in this petri dish that is not the color red are different germs. There are a lot of things in our environment, either within or outside of the NICU, that have bacteria and germs. Following the guidelines in this presentation and the NICU Visitor Guidelines will help minimize bacteria and germs in the NICU. Minimizing germs in the NICU helps keep all of our babies safe. Using hand sanitizer. Alcohol-based hand sanitizer that is 60% alcohol or higher is a good way to clean your hands if you can't see dirt on them. Hand sanitizer is a quick tool, but should not replace hand washing when necessary. Carry hand sanitizer in your diaper bag and car. If you are not sure which brand of hand sanitizer to use, because you are not sure if it is alcohol-based, or if you have a skin sensitivity, be sure to talk to your healthcare provider. Safe practices. We typically think that things like elevator buttons and door handles carry a lot of germs. This is true, but medical equipment in the NICU also has germs, which we may not think about as much. This is why it is important that everyone in the NICU clean their hands before each time they touch your baby. Parents, visitors, and hospital staff should regularly use the sinks around the NICU, the hand sanitizers in the bed space, and the cleaning wipes at the front desk for their cell phones. In some cases, parents may also be asked to wear gloves, face shields, and isolation gowns when needed. Keeping germs away in the NICU. Be aware that anything you bring into the NICU can potentially carry germs and bacteria. Such items include backpacks, jackets, purses, books, toys, and blankets. Try to minimize the number of items you bring into the NICU or clean these items every time before entering the NICU. Reminding others. Remind all staff and visitors to clean their hands following the NICU's hand washing policies. We want to keep your baby safe, but remember that you are the best voice for your baby. Politely asking others to clean their hands before touching your baby, either by washing their hands or using hand sanitizer, is good practice for when you take your baby home. Can you find the germs? Being able to spot surfaces that carry a lot of germs on them can help stop germs from further spreading. Here are some examples of common surfaces that carry a lot of germs. Medical equipment that has not been cleaned or has been touched by uncleaned hands. The hospital has special cleaning supplies to clean medical equipment with. Phones, doorknobs, buttons, and other regularly touched items can carry a lot of germs if not sanitized regularly. Floors which can have a lot of germs on them because of spills, food being dropped, and germs from the outside being brought in on people's shoes. Computers and other electronic devices, which we will talk about more in this presentation. Chairs, either in the hospital bed space, waiting room, or lobby. Please let the hospital staff know if a chair has any spills or mess on them. Trash cans with lids on them will typically have a foot pedal to push in order to open them so that you don't have to touch them with your hands. If a trash can is getting too full, please let the hospital staff know and they will ensure that it is safely and properly taken care of. Clothing that has been worn for a long time or multiple times and has not been cleaned can carry a lot more germs on them. Please remember to wear clean clothes when you come into the NICU. Keeping your baby's area clean. Be aware of where you put your personal items. Remember to keep items off the floor unless it is a car seat. Keeping the number of items in the bed space to a minimum helps the NICU staff keep the area tidy. Regularly clean items that you use while you are by your baby. Clean your hands after using these items before you touch your baby. What has more germs, a toilet seat or a cell phone? Remember that everything inside the petri dish that is not the color red are different types of germs. In these two images, we can see that the cell phone has more germs than a toilet seat. Cell phone use in the NICU. Remember to clean your phone when you first enter the NICU. Wipes for your phone or tablet can be found at the front desk. Be sure to clean your phone regularly while also in the NICU and always wash your hands after using your phone. Cell phones should be put on vibrate or silent when you enter the NICU. This is to help minimize noise for all of the babies. Please take any phone calls or FaceTimes in the hallway, instead of at the bed space. After you first wash your hands when you enter the NICU, there are a lot of other times to make sure to clean your hands, such as upon entering your baby's room, after you sneeze, cough, or blow your nose, before and after you change your baby's diaper, after you touch any area of your body that may have a lot of germs, including your nose, mouth, face, or hair, after you go to the bathroom, after you touch any electronic devices, including your phone, camera, computer, or tablet, after you touch your purse, jacket, or shoes. If you have more than one baby in the NICU, wash your hands after you touch one baby before you touch the other. What to do if you are sick? Symptoms to watch for are a runny nose, cough, fever, sore throat, vomiting, and diarrhea. People with these symptoms should stay home until they feel better. Remember, as difficult as it is to stay out of the NICU when you are sick because you miss your baby, it is for the safety of your baby and all of the babies in the NICU. Keeping germs away at home. Keep up your hand washing habits and remember to wash your hands before touching your baby, after changing your baby's diaper, after using the bathroom, and remind other family members in the home and visitors to wash their hands routinely. Some new habits for when you go home are to wash your hands after wiping another child's nose, after petting or caring for your pet, after cooking a meal, and after doing yard work. Limit contact with germs. Here are a few ways to keep your baby healthy. Limit the number of people who come to your home. Ask visitors to wash their hands before touching your baby. People who smoke should not enter your home or be near your baby without first taking a shower and putting on clean clothes. Do not let people who have been smoking hold your baby. Do not let adults or children who are sick, have a fever, or who may have been exposed to an illness near your baby. Ask adults who may have contact with your baby get a flu, COVID-19, and Tdap vaccination. Try not to take your baby to crowded places, like the shopping mall or grocery stores. Get regular medical care for your baby. Keep baby up to date with vaccinations. All babies, including those who spend time in the NICU, need vaccinations to protect them from serious diseases. Some babies start getting these shots while they're still in the NICU. Check with your baby's provider about when they need their vaccinations. If you have any questions about vaccinations, the best person to talk to is your baby's pediatrician. Schedule and keep all well baby checkups. Well baby checkups are an important way to prevent illness and also make sure your baby is doing well after you leave the NICU. Your first appointment is usually 2 to 3 days after you leave the NICU, and you will have regularly scheduled appointments after that. Make sure to talk with your NICU staff as you prepare to go home to ensure this appointment is scheduled. The free MyNICU Baby app has features to help you track your healthcare providers, your to-do list, and a questions and notes option for checkups. Where you can get support. Remember to talk with your NICU staff if you have any questions. You can also speak with other members of the Lovelace Women's Hospital team for more specific needs or concerns, such as the social work team, hospital case manager, lactation team, or March of Dimes NICU Family Support Program Coordinator. March of Dimes has a variety of online communities and social media outlets designed to help families and stay connected. For a list of March of Dimes online communities, please visit the following website. Things to remember. Wash or sanitize your hands often. Read the NICU visitor guidelines and follow hospital policies to help minimize bacteria and germs in the NICU. Practice good habits in the NICU of cleaning your hands, phone, and other personal items regularly. Be an advocate for your baby and politely remind others to clean their hands before touching your baby. And remember to continue these habits at home.